And we are really honored to have Dr. Shujat Farooq, Professor of Economics and Dean Research, Pakistan Institute of Development Economics, who has kindly agreed to chair this session. Dr. Shujat, please come forward. And I would request Ms. Maimoona Qazi, Research Analyst, UNDP, Pakistan, and the Executive Council member of Population Association of Pakistan. She is the discussant for this session. Thank you, Maimoona. And we do had 4 presentations in this session. We do have with us Dr. Hira Ahmed Farah, Lecturer, Sociology, Government College, Women University, Faisalabad. She is going to present on gender bullying and its socioeconomic impact on women's professional participation, a reform-oriented study from Faisalabad. So Dr. Hira.
Thank you very much. Assalamu alaikum. My name is Hira Ahmed Farah, and I am presenting my research title, Gender Bullying and its Socio-Economic Impact on Women's Professional Participation. This research explores how gender-based bullying affects women's confidence, productivity, and career growth, especially within the professional sector of District Faisalabad. I am grateful for the opportunity to share my findings with you. The issue of gender-based bullying remains one of the most persistent challenges for working women in Pakistan. Gender bullying means any teasing, disrespect, harassment, or unfair treatment that happen because of person's gender. It includes comments, jokes, pressure, or behavior that try to force someone to act according to the traditional gender role. Through this study, I aim to understand its socio-economic consequences and how it limits women's participation and growth in workplace. Forms of gender bullying are verbal abuse, unequal treatment, or exclusion. Economic implications. Gender-based bullying has profound and multi-phase socio-economic consequences for women. Number 1, psychological impact. Decreased job satisfaction, diminished self-esteem, stress, and anxiety are found as the result of gender bullying. If we look at economic consequences, reduced productivity, lower earning, hindered career progression, and pay gap, gender pay gap were found. Career barriers, higher turnover rates, job insecurity, and limited networking. And professional District Faisalabad, our major industrial hub in Pakistan, provides a unique setting in study gender-based bullying. Despite economic significance, the region faced challenges in gender equity or equality and workplace inclusivity, reflecting national trends. Statement of problem. Gender-based bullying continue to affect women's career aspirants and well-being in the workplace, particularly in District Faisalabad. Pervasive issue. Impacting career aspirants, opportunity, and overall well-being of women. When we talk about the unique challenges, female in District Faisalabad face specific hurdles due to prevalent gender-based bullying. Research goals: shed light on the extent and severity of the problem and its consequences. Significance of the study: informing policy, evidence-based recommendations for inclusive workplaces, rising awareness, highlighted barriers to women's career progression, refining practices, organizations can better support female employees, improving well-being, addressing mental health impact, and fostering equity. Here are some key findings. Respondents, mostly 25 to 35-year-old, educated female, some were married and getting 30 to 40,000 per month income. They were aware of policies but lacked in training. Were experience with bullying, lack of their confidence, lack of career growth, and having mental problem or stress level. In conclusion, gender bullying is not just a personal issue, it is a socio-economic challenge that restricts women's professional participation. To build equitable workplace, organizations must adopt inclusive policies, offer training, and create safe environments where women can thrive. Thank you.
Thank you so much, Dr. Hira. And now I would like to invite Ms. Samia Awais from Comsets University. She is going to present her research on Does More Income Buy More Happiness? Empirical Evidence from the World Value Survey in Pakistan. Ms. Samia.
Assalamu alaikum. Thank you, Dr. Saima. My topic is basically regarding the field of socio-economic and empirical study, and the connection with income is in context of Pakistan. Try to prove that Easterlin paradox exists in Pakistan scenario or not. So we use the 7-wave World Value Survey from World Value Report, and going to present this. The topic is very unique and different in terms of what that before this I have seen so many studies that conducted at the international level, but in the South Asia, if we see that such type of studies conducted, so there is lack regarding these type of the studies. So does more income buy more happiness? Empirical evidence from the World Value Survey. It investigated what? The study examined the empirical validity of the Easterlin paradox in the context of Pakistan, and the data we have taken 1995 to 2022. In this study, we have seen the relationship, the combination between the demographic statistics and the social and as well the individual level data. So the analysis confirmed that income has statistically significant positive effect on happiness. However, the inclusion of the squared income term reveals a concave linear relationship that indicates diminishing marginal returns to income. This is the core tenet of the Easterlin paradox, first time in Pakistan. And this study contributes to fulfill the critical gap in South Asian happiness scenario research by providing a country-specific implication, suggests the need for a broader human-centered development strategy that prioritizes the healthcare, education, institutional trust on the political institutions, protection, rather than focusing narrow on the economic growth. So by shifting the focus toward inclusive and holistic well-being, Pakistan can better align in development goals with what truly enhance the lives of its citizens. Briefly, I will tell you about the happiness. When we talk about the happiness, we only measure few indicators, the well-being and mental health and etc. But when when we study this topic worldwide, so these discuss the broader domains of human nature. And happiness is not only the domain of the philosophy and the humanities, it's centrally focused on the macroeconomic, social policy disclosure, and etc. So whenever we are, go through with all these type of indicator related to the happiness, well-being, the Easterlin paradox is very famous. A seminal hypothesis proposed by the Richard Ainley Easterlin. And whenever we are talking about the happiness studies, this is the main founder. He talked and initiated on happiness studies. So when we go through with all these things in the developing economy as well as the developed world, so Pakistan has a growth uneven and socio-economic inequalities persist all the time. Whenever it came into being 1947, still this time we are facing the unequal and unstructured socio-economic inequalities. So these questions are specifically relevant in the Pakistan context, where macroeconomic indicator often suggest growth, yet human development indicators remain the stagnant. So by using the data, we will go through with the theoretical framework. I have used the conceptual framework theories. The utility theory is the first one. Based on that, we derive the consumption utility. Based on that, we check that either the happiness or income has a relationship. Then the social comparison theory is also incorporated, and then the third one is the incorporation of the sense capabilities approach that tell us the functioning and freedom of the human beings. After that, based on the econometric specification, we have used the data from the World Value Survey. So based on the nested culture of the data, we calculated the method account for hierarchical data structure. It allows for random intercept at the community level and improve estimation efficiency and standard accuracy. So this is the basic model, and these are my descriptive results. ये descriptive analysis क्या बताता है when we are using these? So you can see here, first is the individual characteristics, then household characteristics and geographic characteristics. We have observed the 4 provinces, and the Punjab is on the top, where the happiness association with the income is high as compared to the Balochistan and the KPK. After that, our wall test also support our study when we are seeing about multi-level 2 effect ordered logistic regression. हमारी जो variation है हमें first level के ऊपर the zero model incorporate with ICC, then wall test है हमारे पास, and zero model indicates the approximately 19% of the total variation in the individual happiness that attribute to the differences between the communities. Then we calculated the model 1. In model 1, we have seen the relationship between the income and the happiness. So it is positively related or associated with happiness. But when we take the square term of the income, so the term is concave and linear. The relationship is positive, but it is concave or insignificant in that term. So this study provides a robust empirical evidence in support of the Easterlin paradox, and it's proved that Easterlin paradox hold in scenario of the Pakistan. And utilizing the nationally representative data from the latest wave 7, when I started my work, used that. We used mixed effect ordered logistic regression model. We find that while household income is positively associated with happiness, and this relationship exhibit diminishing marginal returns and flatten beyond a certain threshold point. So our result underscored that while economic improvement is necessary, it's not only sufficient for sustainable gains in the subjective well-being, but government also look to see related to the mental health care and trust on the political institutions. Thank you.
Now I would like to invite our third speaker, Dr. Abdul Hakim. He is a social demographer, formerly Director, National Institute of Population Studies, Islamabad, and the staff of Australian Bureau of Statistics, currently associated with Australian Bureau of Statistics. Dr. Hakim is going to talk about explaining fertility decline in Pakistan. Dr. Hakim, please.
Assalamu alaikum. Thank you very much, Chairperson, for patience. My topic is today explaining fertility decline in Pakistan. Most of the things were discussed in the plenary session, and some slides were presented by Dr. Mehtab Karim already, but I will try to share with you because if you don't understand the term fertility or fertility decline, you can't reach to the population growth rate. People start talking about population growth rate, how population growth occurs. That is very important to understand. Can you move it? The objective of this study is to examine the onset of fertility transition in Pakistan. So three things I will be discussing: population growth and related aspects. Second, fertility transition in Pakistan. Then what are the differentials in fertility? And at the end I will give some concluding remarks having some policy implications. Figure 1, please. It is the same thing that in the 2023 census recorded by population, our population was 242 million, about 15-fold increase since the inception of the last century. So population has increased by 600% since 1951 census. About 200 million people were added in the last 62 years compared to the 26 million only in the previous six decades. So this is the important slide, that crude birth rate and crude death rate, which is calculated after 1,000 population. Basically, fertility and mortality are the two crucial factors in a country like Pakistan, where migration has just started now, but not previously. So the most important and powerful factor is the fertility. Fertility remained high, if you can see the blue line, whereas the mortality rate declined sharply. But at the first few decades, it was very close to the CBR, crude birth rate. That is why the increase in the previous 60 decades of the last century was not very sharp or not much. So the gap between both are, so you can see at the moment crude death rate is about 7 per thousand, around about. You can't go beyond that. I think it is very difficult. So it will remain like this. So that's why the increase in population will continue for several decades to come. I think this is very important slide to me. At least I personally feel that very few people have concentrated or given their thoughts on that. So Pakistan's population is very unevenly distributed. Population share, for example, in Punjab is 53% compared to Balochistan 6%, whereas the area of Balochistan is 43% and Punjab has 26%. So Pakistan's population unevenly distributed, and the reason is that that is bit. Next slide, if you see figure 4, please. Population density. Punjab has 622 per square kilometer, Sindh 400, Balochistan almost KPK same, Balochistan 43% per square kilometer, and 94% of population of Pakistan reside in around 500 per square kilometer. So it is very important to note that because of Balochistan, we think that our density is not very high. Mostly population is concentrated in other 3 provinces. Then the next slide, figure 5, age pyramid. I think people have talked about it today. So I don't have to spend much time on this, but this is very important. I think Dr. Mehtab Karim also showed the 1998 census pyramid. And there was a very important point there. If you see this line, for example, this. In the 98, it was a cut here. So that showed that we have some decline in fertility. But because of recent event for the last 10 years, this has increased, which is the worrying point for demographer and all those who are interested in this subject matter. So at the moment, 40% of population is below 15 years, 24% of female in reproductive age, 15 to 49, increase in 0 to 4 years, unlike 17 and 1998. In both those census, there was an undercut. Then next slide, number 6, is share of rural and urban population. Rapid growth in urban population is noted. In 51, 18%, now it is 40%, roundabout. Some people was saying that is more than 50%, but even 40% is a big jump. So then literacy rate, I think that's very important factor in our population. We all want that our children should be educated so that quality of human being is improved. Progress made in literacy rate, overall increase in literacy rate from 17% in 61 to 61% in 23. More increase in rural area from 11% in 61 to 52% in 23. Compared to this, in urban area, increase was from 35% in 61 to 74%. So more sharp increase in rural area. Then percent literate in by sex. Progress also noted in literacy rate by sex. Among females, literacy increased substantially from 7% in 61 to 53% in 2023, an increase of ninefold. Whereas there was only threefold increase in the literacy rate of males from 25% to 68%. So these are the progressing signs both in rural area and among females. Then percent contraceptive use among currently married women. I think you can see that in 23 use was 34% in the last survey of Pakistan Demographic and Health Survey conducted by NIFS. Modern methods used stagnated in 2010s with 26% in 2012 and 25% in 2017. Hardly it happened in any developing country that once you have reached certain point that you start declining in contraceptive use. And among this 34%, substantial use of traditional methods. Unmet need discussed in the morning session by Dr. Nizamuddin, 17%. So if we can meet only 17% plus keep up the momentum of 34% and onward, Pakistan can easily achieve the replacement level in few decades. Trends in singulate mean age at marriage for male and female. I think it is very important slide. Age at marriage continues to rise from 51 to 23. Faster rise about 7 years in female age at marriage from 17 years in 51 to 23 years in 2023. Male age at marriage also increased from 22 to 26 years. The gap between male and female age at marriage narrowed from 5.4 in 1951 to 3.4 years in 2023. So these two slides which I have shown, this age at marriage and contraceptive use, these are the two basically areas which impact the fertility decline or increase. So these are very, I think, hopeful signs for Pakistan that age at marriage is increasing. The previous slides which I showed before these two are the contributing factors which encourage the females and males to have late marriages as well as to plan their family within the married life. Trend in age-specific fertility rate 75 to 2018. You can see the various survey conducted for the last 50 years in Pakistan. All shows steady decline in age-specific fertility rate. Fertility peaks at age 25 to 29 years, births per 1,000 women in all surveys. Next is trend in total fertility rate in Pakistan, 75 to 2018. Downward trend in TFR. TFR 6.3 in 1975, TFR 5.36 in 1997, decline of one child in 22 years. Then TFR 3.6 in 2018, PDHS, about 2 children declined from 97 to 2018 in 21 years. What else we want? That momentum was very encouraging, but unfortunately, the decline faster from 97 to 27. Thereafter, it was a slow decline. Fertility differentials. Both bivariate and multivariate analysis carried out. Multiple linear regression applied to key demographic and socioeconomic factors inversely associated with fertility. Selection of predictors is mainly on the basis of differentials observed in the bivariate analysis and other requirements of the analysis such as significance level and multicollinearity, that is interaction between the variables. Predictors selected are age at marriage, education level of women and husbands, occupation of women and husbands. Multiple R square value 18% indicate that the variation explained by the independent variable was low. Among the predictors, beta value indicate that age at marriage is the most significant variable, followed by education of women, husband's education, husband's occupation and occupation of women. Age at marriage is the most important determinant of fertility in Pakistan. Among the socio-economic variables, educational level of women are significant and important determinants of fertility. Age at marriage is inversely related to fertility. Women who married below age 19 have more children ever born than those who married at age 20 or above. The pattern of differences persists and widen when control for current age of women are introduced. Lower fertility with the rising age at marriage is also visible in the average parity of women aged 45 to 49 years. In multivariate analysis, a woman is predicted to have minus 0.737 fewer children than their other group of. The contribution of other predictors could not diminish its effect. Analysis also shows a negative effect of education on fertility. Mean number of children ever born to women with no education is 4, primary 3.2, middle 2.7, secondary 2.5, and with higher 2.2. The age standardization reveals similar differentials. Differentials are also clearly visible in the average parity for women. Multivariate analysis of women's education found a powerful predictor having negative effect on fertility. An increase in women's education level was associated with minus 0.340 fewer children than those who are less educated. Husband's education and fertility indicate a weak but inverse association with fertility, pronounced only with secondary or higher level of education. In multivariate analysis, husband's educational attainment showed a smaller but significant negative relationship, with one level of increase in husband's education is linked to fewer children. Occupation and fertility. Women working in professional, technical and managerial positions have lower fertility. Women whose husbands work as professional, technical, managerial and clerical employees have also lower fertility than those whose husbands are working in the agriculture services and skilled or unskilled manual work. In multivariate analysis, husband's education has slight negative effect on fertility. Woman's education has a slight positive effect only. Place of residence. Although this variable was not significant in the multivariate analysis, but still I try to present the cross-tabulation results here. Mean number of children ever born is lower in urban area, 3 compared to 3.5 in rural area. When adjusted for age, the difference becomes slightly wider, 2.9 in urban and 3.5 in rural area. Similarly, the pattern of difference exists in average parity, 4.9 children in urban area and 6 in rural area. Similarly, the region of residence does not show much significance in multivariate, but in cross tabulation it shows that mean number of children ever born marginally higher in Balochistan, 3.8, followed by KPK 3.5, Sindh 3.3 and Punjab 3.2. When adjusted for age, this pattern of difference remains with a slight decline in Punjab and marginal increase in KPK and Balochistan. Similar regional pattern is in average parity is noted for women aged 15-49, Punjab 5.4, Sindh 5.5, KPK 6.1 and Balochistan 6.3. Last indicator, wealth index and fertility. Mean number of children ever born to women of richest household class are lower, 2.7, than women of poorest household class, It's 4, not 3. It is a misinterpretation. These differences persist and widen when adjusted for age of women. Similar pattern of difference also noted for average parity, 4.2 for richest and 6.7 for women of poorest households. I prepared a table which Dr. Mehtab has already discussed briefly from 1980 to 2024. I selected 22 countries compared with Pakistan for 80, 95, 208 and 2024. In 2024, below replacement level of fertility, that is 2.1 children, noted for 11 countries, that is Tunisia, Iran, Maldives, Turkey, India, Sri Lanka, South Korea, China, Japan, and of course Australia. Replacement level TFR 2.1 in Saudi Arabia and Nepal. TFR 2.2 in Morocco, Indonesia, and Bangladesh. Egypt 2.6 and Syria 2.7. Pakistan stand out with high fertility 3.6 children among all these countries. Now, concluding remarks and policy implications. Decline in fertility since 1980s, indicating a more gradual and challenging transition in Pakistan. TFR has declined from 6.3 in 75 to 5.4 in 1995, a decline of 1 child in 20 years. TFR decline more pronounced in 90s and early 2000, when TFR 4.1 was reported in PDHS 26-7, a decline of 1.3 in 10 years. Thereafter, the pace of decline in TFR has been slow, only 0.5 decline in 11 years. The decline in TFR documented can be attributed to continued rise in age at marriage and contraceptive use. Of course, these two variables are also influenced by education, work status, and other residential area. Steady increase in population density, urbanization, literacy rate for females, and literacy rate of rural population will contribute to rise in age at marriage and enhanced use of contraceptives. This is if you see the trend in the past, definitely it is going to affect the both use as well as rise in age at marriage. To speed up further decline in fertility, availability of contraceptive at all health outlets need to be ensured, whether it's a provincial program or a federal program. Whatever the ways, the only solution is to provide the services at health outlets where the people feel comfortable to get the services. And of course, their visibility need to be publicized. Need to emphasize on health, education, and human resource development and job opportunities for females. Cultural and religious resistance, if any, can be better overcome through combination of all these. This is my personal thinking. I may be wrong, but definitely I think you don't need to worry about following the political leaders or religious leads. If the thing is in the interest of the people, they will like to avail the opportunity. If they can encourage their children for education, health facilities, and all others, why not family planning? Decline in fertility below replacement level is now almost a universal phenomena. So there is hardly a country is having above replacement level. So there is a potential, certainly in Pakistan, to enhance the use of contraceptive and achieve replacement level fertility within a decade, if not early. Thank you very much. I would like to entertain any, with your permission, whenever you want. Any question?
Thank you so much, Dr. Hakeem. Now I would request our discussant, Ms. Mamoona Qazi, for her remarks.
Thank you very much, our esteemed speakers, for a very insightful discussion on human capital that the session was on. So I think one thing that was common across all these papers was that human capital challenges are multidimensional, and we need to think what we say in our classrooms as well, outside the box and beyond just the numbers or conventional indicators like education, enrollment rates, and health services access. So these papers were a powerful reminder that subjective well-being and bullying, harassment, mental health, all has taken a toll on human capital challenges as well. So starting off with the latest paper, because that's still fresh in my memory, I think this paper was a very good reminder from for us to, earlier in the day we were talking about how there are challenges faced on the fertility rate that's increasing, which still remains there, but it's good to remind ourselves that how far we've come along. Like you showed us that the picture from 1970s and today, so there is obviously room for improvement, which I am totally an advocate of. But it was a good reminder that things are improving, and we need to keep reminding ourselves of that. I think a very key takeaway from this presentation was how you pointed out that modern contraceptive prevalence rate and age at marriage are the key areas to focus on. And in that too, you mentioned how age at marriage is perhaps the only indicator that we need to look at. I would slightly like to add to this that I think female education along with male education levels is perhaps the key area we need to invest in, and probably when our mothers are educated, our young girls are educated, the age at marriage will take care of itself, which you showed later in the presentation as well. So I think taking away from Dr. Durre Nayab's comments earlier in the day, how we need to really invest in our females, and not just invest in terms of education levels, and make the environment so welcoming and safe for them to function and grow further in. So that's my overall comment on this paper. Coming to you, Dr. Hira, a very good area to discuss, really bringing gender bullying and harassment into it. It would have been slightly, I would say, more comprehensive if you would have pointed out how the differences exist between formal and informal sector maybe, or again in the public-private sector as well. You were talking about the professional field generally, so it would have been interesting to see that how the differences emerge in the public-private space as well for these women. And it was good to see that you described bullying as harassment, teasing, and disrespect as well. But bringing in this online sort of, I won't say culture, but sadly it has become a culture of harassment for women. And these days I think UN's 16 days of activism on gender-based violence is also going on. So it's really important for us to see that how all of these things combined together limit the role of women in the workplace. Another thing that I would have liked to see was the type of occupations. You talked about professional field overall, but it would have been interesting to see the differences among the type of occupations, which occupations are there that women are really suffering more in perhaps, and the public-private arena both, and maybe in the hierarchical structure as well. For example, the
public or private sector or not in the occupational sector overall.
Sorry?
I have used snowball sampling to manage my segregation.
I think this gives you room for further research and taking it further, because this topic is really very interesting. So, and these impacts are beyond just her own health. It affects the household, it affects the workplace environment. So maybe room for your paper to, do another paper on this maybe for us to really explore the public-private arena and the type of occupation as well. Dr. Shujat, you can also add in. I think he was telling me about his work on this. Okay, the final paper, Samya. Thank you so much. This paper was very interesting and an interesting study to bring to the front. So I think it's interesting to see your title says does more income buy more happiness. It's interesting to look at it from the other way around. I mean, it could be, does this imply that happier people earn more? And I would like to sort of see that, how do you control for reverse causality in this? Because इसका तो मतलब ये है कि मे बी सिर्फ वो लोग खुश हैं जो ज़्यादा अर्न कर रहे हैं, which is perhaps true as well, but it could be brought about in your presentation as well. And also you talked about the unequal, unstructured socioeconomic inequalities. So it would have been interesting to see that how this plays out across gender and across the wealth status and education levels of these people that we're talking about. So, thank you.
Thank you so much, Mamoona. And before now, I request Dr. Shujaat for his comments. I would like to open the floor for this. Sir, if you allow us, we can take a couple of questions from the audience.
In rural areas, the cost of living is less versus the urban areas. The population density is high and the cost of living is high. So that is why you did not observe a significant difference between the urban versus rural coefficient.
Yeah. I can read out what the regression model.
मैम मेरा क्वेश्चन असल में डॉक्टर हिरा से था जो भी बाहर चली गई हैं गालबन. मेरा क्वेश्चन नहीं, मेरा ऑब्जेक्शन है. मैं फैसलाबाद चैम्बर ऑफ कॉमर्स एंड इंडस्ट्रीज से हूँ और बहुत सारी जो टेक्सटाइल और गारमेंट्स इंडस्ट्रीज़ हैं उनके साथ रिलेटेड हूँ. तो उन्होंने जिस तरह से उसका एक एनवायरनमेंट बयान किया वो बहुत ही एक गलत तरीका है उनका. उन्होंने स्टडी किए बगैर, उनको देखे बगैर, वहाँ पे जाए बगैर, इंडस्ट्रीज़ का इंटरनल सिस्टम देखे बगैर उन्होंने ये कह दिया कि वहाँ पे बुलिंग है, वहाँ पे हरासमेंट है. ऐसा कुछ नहीं है. कराची के बाद सबसे ज़्यादा जो वुमेन एम्पावरमेंट प्रोवाइड करने वाला शहर है वो फैसलाबाद है और हम उनको पिक एंड ड्रॉप की सहूलत देते हैं. हम उनको बहुत अच्छा एनवायरनमेंट देते हैं और बहुत ज़्यादा वुमेन हमारे पास काम करती हैं टेक्सटाइल में, गारमेंट्स में, बहुत सारी इंडस्ट्रीज़ में. तो इस तरह एक स्टडी को ऐसे ही बयान कर देना, ये मेरे ख्याल में उनके पास कोई डाटा भी नहीं. जैसे मैडम ने भी पूछा उनसे कि आपने किस इंडस्ट्री को विज़िट किया, किस लोगों के, किन लोगों के इंटरव्यूज़ किए, ऐसा कुछ भी नहीं है. तो मेरा ये ऑब्जेक्शन है, बेसिकली क्वेश्चन नहीं है उनसे.
डॉक्टर इफ्तिखार से नादिल S3I से. मेरे क्वेश्चन तीनों प्रेजेंटर से हैं अलग अलग. पहले समिया से कर लेते हैं. समिया, आपने ये कहा कि जो इनकम है वो इन्वर्स रिलेशनशिप है उसका हैप्पीनेस के साथ, वो कैसे बनता है? थ्योरी कौन सी कहती है और आपने प्रूव भी नहीं किया तो उसका स्क्वायर क्यों ऐड किया?
सर बेसिकली हमने एसोसिएशन हैप्पीनेस और इनकम की चेक की एट द टू लेवल. अकॉर्डिंग टू आवर स्टडी जब हम उसको इंडिविजुअल लेवल के ऊपर देखते हैं तो जैसे कि मैंने आपको अपनी स्टडी में बताया, द स्टडी एग्जिस्टिंग द पॉजिटिव रिलेशनशिप, ठीक है. बट जब हम उसका स्क्वायर टर्म लेते हैं तो अकॉर्डिंग टू द स्टडी आपकी कनकेव लीनियर प्रोग्रामिंग बनती है. आपका जो रिलेशनशिप है दिस इज़ पॉजिटिव, लेकिन जो इसकी ऑड रेशो आती है सर जो उसकी एसोसिएशन है दिस इज़ पॉजिटिव, लेकिन हम जब उसकी स्क्वायर टर्म लेते हैं तो ऑड रेशो के अकॉर्डिंगली जो आपकी ऑड रेशो है वो बताती है कि जैसे जैसे इनकम बढ़ती चली जाती है तो अप टू अ सर्टेन लेवल आपकी हैप्पीनेस डिक्रीज होना शुरू हो जाती है, डिक्लाइन होना शुरू हो जाती है.
इसके बिहाइंड कोई थ्योरी है या?
यस सर, 3 थ्योरीज वी हैव यूज्ड. यूटिलिटी थ्योरी
इनसिग्निफिकेंट आया तो मेरे ख्याल में उसको ऐड ही नहीं करना चाहिए था
सर. लेकिन नहीं, इसके भी देखें जब स्टडीज़ के अंदर हम कोई भी वेरिएशन लेकर आ रहे होते हैं तो पॉजिटिविटी तो मौजूद है ना. अगर वो नेगेटिव आ रही है सेकंड स्क्वायर टर्म लेने के बाद तो फिर सर उसका इम्पैक्ट शो करना स्टडी में बनता है. क्योंकि सर हम तो नहीं कह रही, ये तो वर्ल्ड वैल्यू सर्वे है. जब हम उसको कम्युनिटी और इंडिविजुअल लेवल दोनों पे देखते हैं तो अकॉर्डिंग टू द रिपोर्ट दैट शोज, मैंने बल्कि वो ग्राफ मिस हो गया, उसमें भी मैंने शो किया हुआ है ये कि किस तरह से हैप्पीनेस आपकी जो है वो इंक्रीज और डिक्रीज होती है एट द डिफरेंट लेवल, एट द कम्युनल लेवल और एट द इंडिविजुअल लेवल.
दूसरा क्वेश्चन सर हकीम साहब से मेरा कि सर आपने जो वेरिएबल सिलेक्ट किए वो किस बेस पे सिलेक्ट किए? उसमें आपने एजुकेशन ऑफ हस्बैंड भी लिया, एजुकेशन ऑफ वाइफ भी लिया. हाईली कोरिलेटेड वेरिएबल्स हैं. इनमें मल्टीकोलिनियरिटी का बहुत ज़्यादा चांस है. एज अगर दोनों की ले रखी है तो उनमें बहुत ज़्यादा चांस है. तीसरा, आपने जो वेरिएबल मिसिंग मुझे लग रहा है दैट इज़ लेयर टाइम ऑफ द हस्बैंड. अगर उसके पास टाइम ज़्यादा है तो मे बी फर्टिलिटी ज़्यादा हो, आपने उसको छोड़ लिया. यानी जो इम्पोर्टेंट वेरिएबल है, एक बंदा 2 बजे आ जाता है, एक बंदा रात 10 बजे 11 बजे घर को जाता है, तो उसका टाइम किधर जाएगा?
پہلی بات تو یہ ہے کہ کوشچنر میرا نہیں تھا تو آئی ہیو ٹو پک اپ فرام دی ویریبل فرام دی نیشنل لیول سروے. تو ویریبل جو ایکسکلوڈ کیے گئے ہیں فرام دا ماڈل آر ویلتھ فلو, ٹائپ آف پلیس آف ریزیڈنس اینڈ ریجن آف ریزیڈنس بینگ اسٹیٹسٹیکلی نان سگنیفیکینٹ. اور جو دی اسٹیپ وائز ریگریشن پروسیجرز کنسٹرکٹیڈ دی فائنل ماڈل آف 5 ویریبلس, دیٹ از ایجوکیشن, ایج ایٹ میرج, ایجوکیشن
ایک بندے کی آنی
نہیں
چاہیے,
دونوں کی, اس میں کولینرٹی نہیں آئی
دونوں.
وہ اس کو یہ ماڈل ایسا ہے
سر یہ پاسبل نہیں ہے, یہ میں بتا رہا ہوں تھیوریٹیکلی.
نہیں
ایک بندہ پی ایچ ڈی ہے اور وہ ان پڑھ لے لے, یا ان پڑھ فیمیل ہے اور
اس کی سگنیفیکینٹ لیول دیکھنی پڑتی ہے نا. سگنیفیکینٹ لیول واز لیس دین 0.00. یہ تھا پہلا کوشچن آپ کا. بڑا اچھا پوائنٹ تھا جو آپ نے ریز کیا کہ ایجوکیشن امپارٹنٹ فار ایج ایٹ میرج. سرٹنلی ایکچولی میرا جو پوائنٹ کہنے کا یہ تھا کہ دیکھیں فار ایگزامپل 15 to 49 ایئرس ایج ہوتی ہے ریپروڈکٹیو ایج. اف دیر از نو رائز ان ایج ایٹ میرج, ایوری ون میری ایٹ ایج 15, وہ کتنے بچے پیدا ہوں گے؟ اور ڈونٹ یوز اینی کنٹراسیپٹیو. یو ہیو سم آئیڈیا؟ 14.1 میں ڈاکٹر بیٹھے ہوئے ہیں ادھر, وہ مجھے انڈورس کریں گے. 14 بچے پیدا کر سکتی ہے ایک عورت. اس وقت پیدا ہو رہے ہیں 3.6,
3 to 4, آئی مین ایوریج 3.5.
اس وقت نہیں, نیشنل لیول سروے جو ہے نا اس کا ہم تو اس کی بات کر رہے ہیں نا.
جی
اس لیے ہر محکمے میں کو آپ فیملی پلاننگ والوں کو برا بلا ہم کہہ سکتے ہیں, لیکن میرے خیال میں دے ہیو ڈن بیٹر.
ایک جگہ پہ سر آپ نے یہ بھی فرمایا کہ ایک سال اگر ایجوکیشن بڑھ جاتی ہے تو نمبر آف چلڈرن 0.12 کم ہو جاتے ہیں. تو اس کا مطلب یہ جو بندہ میٹرک ہے اس کے
لیول آف ایجوکیشن پرائمری مڈل,
نارملی تو ہم یہی دیکھ رہے ہیں کہ میٹرک والے کے بھی 3 سے 4 بچے ہیں اور پی ایچ ڈی والے کے بھی 3 سے 4 بچے ہیں.
آدمیوں کے بارے میں آپ کہہ سکتے ہیں, عورتوں کے بارے میں نہیں کہہ سکتے. عورتیں جو ہے نا بہت سمجھدار ہوتی ہیں, یقین کریں ان کی پرائمری لیول کی ایجوکیشن بھی کنٹریبیوٹ کرتی ہے ٹورڈ اسمال فیملی. اینی وے
اوکے, تھینک یو. تیسرا کویشچن میرا ڈاکٹر ہیرا سے تھا کہ بیسیکلی انہوں نے بلینگ ڈیفائن کیسے کی ہے. دوسرا کویشچن یہ تھا کہ از اٹ یونی ڈائریکشنل یا بائی ڈائریکشنل, یہ دونوں سائڈ پہ ہے, کس طرح سے ہے. تو وہ تو چلی گئیں, تو پھر اس کا مطلب فردر کویشچن کرنا بھی غلط ہوگا.
ان کا موبائل پڑا ہوا ہے.
تھینک یو.
Thank you so much. Any other question from the floor? Okay, if there is no question, then I would request Dr. Shujaat Farooq to please enlighten us with his comments. Dr. Shujaat, please.
Bismillahirrahmanirrahim. Thank you, Ji. Very nice presentation, and I will focus on these 3 topics, starting from Dr. Hakeem Saab, where they have attempted to explore the factors that are declining the cause infertility. So Dr. Saab, very excellent presentation where you have pinpoint the picture from almost 1947 to onward by taking lot of indicators including mortality, fertility and various other dimensions including the provincial area, etc. But you are ignoring one dimension, and that is the macroeconomic environment of the country. You are focusing on the micro factors. So for example, what is the reason that, for example, Bangladesh in 1980, Bangladesh hold more fertility rate than Pakistan. They have more population in 1971 than Pakistan, but now they are around 170 million and we are crossing the 225 million. So whole scenario, one thing is missing, that is the economic landscape of the country. So until we don't have a decent growth that create the jobs for the youth, I think alone these traditional methods, family planning, that will not make the dent on behaviors. So for example, if you see the labor force survey of Pakistan, over the last 25 years, there is not a major shift on female labor force participation. Despite that, for example, female enrollment at higher education was just 21% in 2001, and now it is more than 50%. But unfortunately, these females, they are not translating from education to labor. So I think that is the major myth Again, comparing with Bangladesh, for example, in 2001, they have half export than us, $5 billion, and we were at $10 billion. Now they have the double export. And especially look at their garment sector where females are concentrating more than 70%. So I think without economic landscape, explaining fertility, that would be too crucial. So we must have to think about this dimension, that how we can ensure females decent entrance in the labor market. और ये जो हमारी decent entrance in the labor market है, that is also linked with the second study जो हमारी एक जिसको कहते हैं अपना bullying के ऊपर थी. तो आप bullying के ऊपर देखें, we have this study at PIDE. We conducted a survey for UN Women and UNDP, or we conducted this survey with females, और हमें पता ये चला कि more than half of the female, they feel unsafe on public transport, and we don't have the decent transport system. आप देखें जब एक female बाहर निकलती है तो उसके पास क्या transportation है, mostly it is public sector है, and almost 2/3 of young female they are reporting कि जब भी वो बाहर निकलती हैं someone stare them. तो ये वो dimensions हैं कि जिसके ऊपर हमें शायद बड़ा seriously काम करने की ज़रूरत है. Lot of legislations is there, but unfortunately same हमारे चैम्बर के कोलीग कह तो रहे थे कि जी we have quite decent work environment, लेकिन मेरा क्वेश्चन है कि 25 साल में क्या वजह हुई है कि फ़ीमेल तालीम ले रही हैं but that education is not translated into labor market. आज भी आपकी आधी डॉक्टर्स MBBS वेयर यू स्पेंड लॉट ऑफ अमाउंट, वो भी घरों में बैठी हुई हैं. तो ये कुछ कल्चरल फैक्टर्स भी होंगे जिसको कहते हैं कि जिसकी वजह से फीमेल शायद पेरेंट्स आर देयर डिसीजन मेकर्स वो उनको मार्केट में नहीं लेके जा रहे. बट देयर कुड बी सर्टन फैक्टर्स ऑन लेबर मार्केट कि क्या ये मुआशरा उस काबिल है कि मैं अपनी बेटी को बाहर भेजूँगा जॉब के लिए. जस्ट फ्यू डेज अगो आई वॉज ट्रैवलिंग ऑन डाइवो, और वहाँ पे वो रोड होस्टेस थी, तो मैंने उससे यही सवाल पूछा. मैंने कहा पर्सनल लीजिएगा, मुझे ये बताइएगा अगर आपकी कल बेटी होगी वुड यू लाइक कि वो ये जॉब करे. कहती है नेवर एवर. तो ये हमारी सोसाइटी है. तो इस सोसाइटी में कौन बाहर निकलेगा, कौन जॉब करेगा. तो इस एंगल को हमें शायद बड़ा एज अ होल इकोसिस्टम में देखना होगा कि दिस इज़ ट्रू कि हम वी आर फेसिंग लॉट ऑफ हैरेसमेंट, लॉट ऑफ बुलिंग. और उसमें जो एक चीज़ मैडम ने ऐड नहीं किया, दैट इज़ साइबर बुलिंग. कि इस वक्त अगर आप देखें तो बाकी तो चले बुलिंग को आप शायद कहीं ना कहीं कंट्रोल कर लें, लेकिन आप यहाँ पे बहुत सी बच्चियाँ इस रूम में बैठी हुई हैं, दे कैन टेल यू कि शायद वो ऑलमोस्ट वीकली बेसिस पे ये साइबर बुलिंग फेस करती हैं. ना उसके ऊपर हमारी कोई प्रॉपर लेजिस्लेशन है, ना कोई हमारी अवेयरनेस है, ना वो कल्चर है कि हम इसको कैसे क्रश कर सकें. कमिंग टू दी थर्ड प्रेजेंटेशन, वेरी इंटरेस्टिंग टॉपिक के जहाँ पे हम हैप्पीनेस को इनकम के साथ लिंक कर रहे हैं. तो मैम मेरी अर्ज़ होगी कि देखिए जब भी हम इस तरह के सेमिनार्स में आते हैं तो हमारे 2-3 बड़े की पॉलिसी मैसेज ज़रूर होने चाहिए. ठीक है ना जी. दैट्स गुड कि जी के वी प्ले विद डाटा, वी हैव सर्टन स्टैटिस्टिकल टेक्निक्स और हमारी फाइंडिंग भी निकल आती है. बट ये है कि 1-2 बड़ी कंक्रीट पॉलिसी फाइंडिंग्स हों कि जो कल को पॉलिसी मेकर्स उसको आगे वो यूटिलाइज़ करें. तो जिस तरह मैम ने कहा है कि अगर आप पाकिस्तान में देखें तो स्पेशली पिछले 2-3 साल में आप देखें तो जो इन्फ्लेशन हुई है उसने आपकी मिडिल क्लास को कैसे इम्पेक्ट किया है, हाउ दे आर स्ट्रगलिंग विद दैट. तो सर्टन इस तरह के जो पॉलिसी क्वेश्चंस हैं वो ज़रूर रिसर्चर्स को साथ लेके चलने चाहिए कि जहाँ से एक सोसाइटी की जो एक पेन पिक्चर है वो एटलीस्ट आपकी रिसर्च में दैट मस्ट बी रिफ्लेक्टेड. बट ओवरऑल आई कंग्रेचुलेट दी पैप, डॉक्टर साइमा and all the organizers for managing this presentation. I also learned a lot of from your presentation. So thank you very much. I think I have respected the time and now you can go. Please, thank you. Take care.
Thank you so much, Dr. Shuja. Thank you so much. And yes, we are well on time for this session. And I would like to thank all the presenters for sharing their very valuable research with us. Mamoona, thank you so much for providing us very insightful remarks and thoughts for discussion. Now, call Dr. Faisal. Dr. Faisal, please come and share a vote of thanks for our chair and discussant. Thanks. Dr. Shujat, please. And now I would request Mamoona, please come forward and. Thank you so much, and with this, we conclude this session.